Can a hormone therapy meant to help you actually harm you? Could something as common as a hormone estrogen therapy in the form of a pellet be linked to a stroke? Today, I'm diving into a powerful article from Medscape called Cleanup on Isle Med Spa, and it's raising serious questions about how some med spas are prescribing hormone and what every woman needs to know before saying yes to pellets or so-called natural hormone treatments. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends and family, and subscribe. So this article, and the reference is in the description, begins with a powerful story. A woman is hospitalized with a stroke, and her doctor believes that it may be linked to a hormone pellets she got at the med spa. First of all, what is a pellet? A hormone pellet is a small, fry-sized insert that goes under your skin and slowly releases hormones over time. And these pellets often contain compounded estrogen and testosterone, and the hormone levels can be much higher than what your body naturally needs. Compounded means that a pharmacist prepares a customized, a specific medication that may have dosages that are different from standard dosages. So this is in contrast to commercially available hormone therapies, which are mass-produced in standardized dosages and formulations by pharmaceutical companies and are regulated by the FDA. So here's the concern. Estrogen in high or unbalanced amounts can increase the risk of blood clots, and blood clots can lead to stroke. So when estrogen is prescribed in carefully controlled dosages, especially through FDA-approved patches or gels, that risk is much lower. But with pellets, there's no way to adjust the dose once they're implanted. And if they're not balanced, the risks go up even more, including abnormal bleeding, stroke, or possibly even cancer. So let's look at the big picture. What are the hormone recommendations for pre- and postmenopausal women? In general, before starting any kind of hormone therapy, whether it's FDA approved or compounded, it's essential that women are properly screened. So hormone therapy is not one size fits all. A full medical history, family history, and sometimes lab work are needed to determine if it's safe and appropriate. This is not something that should be handed out casually or without supervision. And some women should not receive estrogen therapy. The criteria for avoiding hormone treatment include a history of hormone-sensitive cancers like breast cancer or uterine endometrial cancer, unexplained vaginal bleeding, a history of blood clots, deep vein thrombosis, or pulmonary embolism, a past stroke or heart attack, active liver disease, a history of thrombophilia or any clotting disorders, and, well, obviously allergy or hypersensitivity to estrogen products. These conditions can make estrogen therapy dangerous, and that's why careful screening by a qualified provider is so important. When hormone therapy is prescribed responsibly, it can be incredibly effective, but when these safety steps are skipped, the risks go up. Now, let's focus on the potency of these hormones. One study mentioned in this article found that 34% of compounded hormone products didn't pass potency testing. That means that the dose was either too strong or too weak. For comparison, only 2% of FDA-approved hormone therapies had that same problem. This matters because hormones affect so many parts of our body. Getting the wrong dose can cause unwanted symptoms or lead to more serious health risks. And let's also take a closer look at testosterone. Testosterone is another hormone that is often included in pellets, but it's not always used appropriately. In women, testosterone is only approved for one specific condition: hypoactive sexual desire disorder. And even then, it should be prescribed carefully. Too much testosterone can cause side effects as well, such as acne, facial hair growth, voice deepening, irritability or mood swings, irregular periods. And just like with estrogen, once the pellet is placed under the skin, you can't remove it, so if side effects happen, you're stuck waiting months for them to wear off. Of course, one of the key questions to ask here is why patients turn to med spas. Many women go to med spas because they feel like their regular doctors aren't helping, and I understand that. Med spas offer solutions for symptoms like hot flashes, fatigue, and low libido, and they often market their treatments as more natural or safer. But what's often missing is regulation. We already have FDA-approved options like estradiol and micronized progesterone, and they are bioidentical, well-studied, and usually covered by insurance. Compounded therapies may sound appealing, but without standard dosing, the risks can be unpredictable. And so here are my thoughts about the issues that this article brings up. As a physician trained in both functional and conventional medicine, I fully support hormone therapy when it's used safely and monitored properly. And there are excellent FDA-approved options available that offer symptom relief with much less risk, and they can still be bioidentical, meaning that they match your body's natural hormones, and just with more consistency and oversight. And if you are using compounded hormones, don't panic, but do make sure you're working with someone who understands how to monitor your treatment and adjust as needed. And I want to be very clear, I'm not against compounding pharmacies. I work with them and I value what they offer, the personalized approach, especially when patient needs something that's customized, personalized, individualized. But with compounded hormones, we need to be super diligent. They require extra care, accurate dosing, and regular monitoring to be used safely. It's not about fear, it's about being informed. If you enjoyed this video, please don't forget to like, share, subscribe, and hit that notification bell so you don't miss more videos about similar topics. Thank you so much for watching. Until next time, bye-bye.